Welcome to another MedTech Gurus podcast, where we meet and discuss trending and educational topics that are important to today's medical technology sales and marketing professionals. Now, it doesn't matter if you're new to the space or if you're a seasoned medical sales and marketing professional. You all have come to the right place. You see, the medical technology world is ever-changing, and MedTech Gurus will help you stay up to date by interviewing experts and opinion leaders. Now, we call them gurus, and they will bring you information, techniques, and strategies that are sure to help you enhance your knowledge and help you bring value to your customers and your company. Now, I'm Sylvester Harris, and I'm pleased to introduce your host for MedTech Gurus, Mr. Tom Hickey.
Hey, what's going on out there, gurus? This is Tom Hickey, your host of MedTech Gurus, and welcome to episode number 275. In this episode, we explore the cutting edge of healthcare innovation with Dr. Prentice Tom, Chief Medical Officer at Kintsugi. With a distinguished career spanning clinical care, health policy, and executive leadership, Dr. Tom shares how AI is revolutionizing mental health assessment using voice biometrics. We dive into the challenges of mental health care, the power of objective and scalable AI tools, and how Kintsugi's technology is bridging gaps in diagnosis and access. Dr. Tom provides invaluable insights into fostering creativity, overcoming biases in AI, and the future of mental health care in a rapidly evolving healthcare landscape. This is an episode full of inspiration, thought leadership, and actionable strategies you won't want to miss. But before we get into the episode, let's thank our sponsor, Accelerant Consulting. Gurus, GPOs, RPCs, IDNs, it'll make your head spin. Don't go it alone. We understand you need to get those sales going and boost that bottom line, and you need to do it now. Let the experts at Accelerant Consulting guide you through today's complex healthcare market. Check them out at accelerantconsulting.com. That's EXCELERANT consulting.com, and do it today. Okay, gurus, here it comes, episode number 275. And remember, if you like what you hear, please subscribe, leave a review, and most importantly, tell a friend. Welcome, MedTech Gurus. Today, as I mentioned in the introduction, we have a special guest with us. Prentice Tom, MD, Chief Medical Officer at Kintsugi, joins us. Dr. Tom has had an incredible career in healthcare, spanning over 4 decades, with experience across clinical practice, health policy, academia, executive leadership, and health innovation. His work has allowed him to lead and innovate in areas critical to both patient care and healthcare system improvement. Currently, at Kintsugi, he's helping to leverage AI to transform mental health assessments through voice analysis technology. Dr. Tom has his Doctor of Medicine from Harvard, a BA in Biophysics from the University of California, Berkeley, and was a Kaiser Fellow in Health Policy at MIT. Hey, Prentice, are you ready to be our guru today?
Absolutely. It's a pleasure to be here, Tom.
We're very excited to have you. So tell us something fun or interesting about yourself or your family so we can get to know you a little better.
Well, I'm an avid skier. I've skied all over the world, South America, Europe, all over North America. And I spend a lot of my winters up in the mountains skiing nowadays. I'm not a great skier, but I just enjoy it tremendously.
I love it. Yeah, I like it as well. Once upon a time, way back when I was just starting out in this career, I worked for a company based in Boulder, Colorado. So I got out to the Rockies. And as a matter of fact, I'm going out this winter to spend a couple of days with my son to go skiing myself. So maybe we'll see you on the slopes one day.
Hopefully, that'd be great. I actually enjoy skiing with others. It makes the whole ski trip much more enjoyable.
Yeah, for sure. So first of all, Prentice, you've had an incredibly diverse career spanning clinical care to health innovations. I'm wondering if you can share some of the most pivotal moments that led you to where you're at today at Kintsugi and working with AI and mental health. Can you walk us through that at a high level?
Sure. As a physician and as a physician executive, I've always been driven by looking at where there's need in healthcare, what's currently our greatest gap in care, what can we do better? And in looking at program development, I was previously with CP America Vituity, and what we were looking at was usually, it's nothing exotic or esoteric. In the 80s and 90s, it wasn't uncommon, for example, for patients to wait 10, 12 hours in an emergency department to be seen. And so we created a simple, actually fairly elegant solution called rapid medical evaluation, where we re-engineered patient flow and circumvented the normal triage process. As an emergency physician, looking at where there were huge needs in healthcare, one of the largest is in inpatient psychiatric care and moving patients from the emergency department to an inpatient unit. In California, it takes over 2 days to move a patient from an emergency department to an inpatient unit because we're so underbedded on a national level in terms of psychiatric care. And so one of the things we did is I recruited pretty much the national expert on developing a program called Empath Units. His name was Scott Zeller. And he created the ability to place into an emergency department both a telemedicine unit and adjacent crisis stabilization unit. And those two components would work with an inpatient psychiatric facility and result in a significant decrease in the stay in the emergency department for patients who needed emergent psychiatric care. And that got me interested in psychiatry and the issues of mental health that we're facing patients in the United States, because it's truly an area of enormous need. At that time, they're starting to publish papers about 1/3 of all youth in the United States suffer from anxiety disorder. Depression is the single largest undiagnosed condition in the United States. And so it was an enormous issue. I just happened to come along and met with Kintsugi and Grace Chang, who is the CEO and founder of that company. And she was very interested in looking at new modalities of screening patients to help improve the ability for patients to access care. And the tool that she developed, this voice biometric tool that uses artificial intelligence to screen, was truly an enormous step in the right direction to helping improve that type of screening process. And that's sort of how I got involved in Kintsugi.
That's fascinating. And, just to build on that for a moment, Kintsugi, with their AI technology, seems to be making strides in how mental health conditions are assessed through voice analysis. I'm wondering if you can take us through, and explain how this technology works and what makes this a true game changer for mental health assessment. Can you help us out with that?
Yeah, I actually really enjoy talking about this topic, Tom, because it's truly an elegant technology. When we look at functional neurologic assessments, what physicians are often doing are very, very simple tests. Like we have people rub their heel against their shin, or we have them touch their finger to their nose and to someone else's finger to check for dysmetria. Or we have them walk in a straight line, things like that. Really simple neurologic assessments that involve maybe a dozen or so muscle groups. When we create sound, it's a much more complex cognitive neuromotor activity. We have to formulate the idea, and then we have to translate that idea into physical form, sound. Not only is that an incredibly complex neuromotor function, but it's also one that's influenced by all types of diseases, both physiologic states and pathophysiologic states. When we create sound, it involves essentially almost 100 muscle groups. We have to use our nares, our lips, our tongue, our throat, our cheeks, our intercostals, our diaphragm, our back muscles, and we have to coordinate them all at the same time. So what Kintsugi is doing is we're looking at the neuromotor manifestations of a pathophysiologic condition as manifested through sound creation. So we're not listening to what people are saying. We're actually listening to how they create sound, and we're using complex computational biometric analysis to come up with a profile based on how that sound is created and correlating that to an annotated database on whether people have depression or not, whether they have anxiety or not. And we're able to develop individual profiles based on that type of information.
Well, that's fascinating, and it really does indicate, how truly, our voice is an instrument, right? With all the moving pieces.
Oh, Tom, it's really well. It's nothing that should surprise us. Actually, when we have diseases like or conditions like drug use, alcohol use, fatigue, Alzheimer's, Parkinson's, there are very evident vocal characteristics that are associated with those conditions. And so there's actually there's many pathophysiologic states that influence our sound creation. And so they've actually known for many years that depression influences how we create sound.
Well, that's fascinating. And then to build on that, looking at AI, in reading and learning what we've had to date, one of the critical concerns with artificial intelligence is ensuring fairness and minimizing bias. And I'm curious to learn, how does Kintsugi approach bias in this technology, especially, with what you've just explained, given the diversity of patients and languages in healthcare? Can you provide us some insights there?
Well, that's what's actually really a real positive about the tool, is that when we look at neuromotor function, again, because we're not listening to what they say, whenever a clinician is talking to a patient, in order to assess them, they have to have a conversation and they interpret what they say. But what we say is influenced by the language we speak, our educational level, our ethnicity, our gender, the region of the country we're from. All those things can influence how we look at various things and what we say, and not only from the perspective of the patient, but also from the clinician. But what we're doing is we're taking sound, we break it down to its individual phonemes, and we look at the spectrum prosodic elements of sound creation. And so we're just purely looking at a neuromotor function. It's no different than someone having a stroke and looking at their muscle strength, someone having multiple sclerosis and engaging it by looking at the reaction time, or someone having Lou Gehrig's disease and looking at how their motor function's working. So it's much more objective as a tool actually than the standard mechanisms of having a conversation with somebody to determine whether they're depressed or anxious or not.
That's fascinating. So if this may be oversimplistic, but if I'm excited, my voice will have a higher tone to it. If I'm depressed, maybe it'll be a little more quiet. So is it those cues that you're zeroing in on?
So there are multiple physiologic and pathophysiologic states that influence how we create sound. Certainly excitement is one, anger, sadness, but we are actually our tool differentiates between these various physiologic states, and we actually look at pathologic depression. So we're able to actually tease apart the various characteristics of sound creation between these different conditions, just as someone could do between, say, fatigue and alcohol use. We can start to listen, but what happens now is, using artificial intelligence, we're able to really dive deep into the characteristics of each one of those conditions and how they impact sound. And so, yes, conditions like you can be excited while you're anxious, and we can actually start to separate those conditions out and just look at the ones that we're interested in.
Oh, that's fascinating. And I'm going to shift the conversation slightly on you here, but with your extensive experience in healthcare, I'm kind of curious about what are some of the biggest challenges in closing gaps in healthcare today. Do you have any insights in that area for us?
Yeah, I think that's an interesting question, Tom, because I think the largest gaps in healthcare don't result from medical care. They actually are a result of various socioeconomic demographic issues that impact us. when we look at how healthcare is financed, disparities in access, educational levels, various societal and institutional factors that impact things like our diet, our stress levels, things like even social media and how they influence our health in terms of conditions like obesity, drug use, traffic accidents, cancer rates, depression. Those are the real key factors that end up creating gaps in healthcare. It's not the medical care as much as these social issues that create conditions that various groups in the population suffer from at varying rates. And our ability to provide the level of resources that are necessary it can't be answered by just changes in medical care. It's not like we can invent a pill that's going to solve some of these issues. And so I think these gap issues that we talk about, they have much more to do with these socioeconomic factors. And I think that's it's a difficult thing to address.
Yeah, absolutely. And then I'm also curious about your experience as a futurist and a chief innovation officer. So I'm wondering if you could help our gurus out there, in what should they be doing to foster an environment that encourages creativity and pushes the boundaries of what's possible in health technology? Do you have any advice for our gurus in that area?
I think that innovation and creativity, it's a balance, because on the one hand, innovation requires an enormous amount of focus and hard work. And on the other hand, it requires a willingness to experiment. And so that sounds like it's sort of the opposite of focus, but we need to be able to fail fast and fail often. And we need to try out many different things, and we need to be non-punitive when people try things and experiment. And it's actually a mantra you've heard over and over, try, fail fast, fail often. I do partially disagree with the adage, learn from your mistakes, though. I think to a degree it's useful, but that review has to be contained. I actually think it's more valuable to just dust ourselves off, get up and swing again, and not spend so much time worrying about, okay, why did we fail, but just moving on to the next thing.
Yeah, that's kind of
that type of culture is really necessary.
Yeah, which is kind of tied to that non-punitive environment, right? So you can just kind of move on, right? And doing the post-mortem per se, right?
Yeah.
Gotcha. So coming back to artificial intelligence, from your perspective as AI continues to advance, I'm wondering, if you could provide us some insights as to some of the ethical challenges that healthcare leaders should keep in mind when deploying AI-based solutions in healthcare applications. Do you have any thoughts for us there?
Tom, I'm not sure it's an ethical consideration, but certainly one of my biggest concerns with AI in healthcare is we need to guard against it fostering laziness. These AI tools, they're by no means foolproof. In fact, they're meant to augment decision-making, not to supplant it. I use things like Copilot and ChatGPT. They're wrong all the time. In fact, I'll have answers where they just contradict them. The ChatGPT will just contradict itself with its own answer. And so we need to realize that these tools, they are valuable, but they're also limited in what they can do. For example, Kintsugi is meant to be a screening tool. It's not a diagnostic tool. We can't, as physicians, use these tools to make the clinical decisions for us. It can only just help guide us into a direction. And so I think that's actually one of my biggest concerns, is that we'll take these tools and we'll let them do more than they're actually meant to do, and they can create a laziness in our clinical approach to conditions. You certainly wouldn't want someone to use the Kintsugi tool and just because of result, start putting that patient on Zoloft or something like that.
Yeah, that's helpful. I've worked some with some of those tools myself, and I find that, they're useful to help me format some things, but I definitely have to go back and work through it, right? So thinking about the diagnostic tools, it is kind of scary, I think.
Yes.
Yeah, for sure. So, Prentice, in the field, of AI in healthcare, there's no doubt that it's growing rapidly. As a futurist and with your experience, I'm kind of wondering, what do you think the next 5 to 10 years will look like, especially for AI's role in mental health care? And how do you see Kintsugi leading the charge? Can you provide us some thoughts there?
Tom, I actually appreciate this question because I think that there is probably no area in medicine that can benefit more from a more quantitative approach than mental health care. Right now, if we look at all fields of medicine, there's really no area that is more art and less science than the area of mental health. A lot of times it's a clinician sitting here, well, Tom, after talking with you for an hour, I've decided you're depressed. And there's no science, there's less science to that. And so if we can create a tool like Kintsugi that is completely non-invasive, highly scalable, quantitative, and reproducible, we can change this entire area. We can move it from one that is much more art, subjective, full of bias, to one where there is a quantitative scientific basis, and move it to much more like cardiology, where you can measure ejection fraction, where you can measure cholesterol level, where you can measure blood pressure. And we can start to have some true biometrics of people's mental health wellness. So I think that these types of tools are incredibly useful. Not only that, when we have a tool like Kintsugi that is highly scalable, then we can start to do screening on a population level. Right now, when we look at mental health, there are over 50% of all counties in the United States don't have a psychiatrist, Tom. There's not one that's in that county. And so because of the lack of resources, we only look at the very far right side of the spectrum with respect to mental health, those who have significant disease and who need significant therapy. And that creates a stigma around mental health. Actually, we all sit on the spectrum. Everyone sits on the spectrum. It's like blood pressure. We all have one. And when we can start to screen on a population level, then we create a paradigm shift in how we view mental health at all. Because not everyone needs to have a psychiatrist. Maybe some need a family therapist. Maybe some need a week of vacation or peer-to-peer counseling. Maybe someone just needs a massage, and what we can do now is we can actually create a different view of how we view mental health. We can address these issues earlier on. And so I think that tools like Kintsugi will be incredibly valuable to the future of mental health care because they allow us to create both a quantitative, more scientific approach, and they allow us to scale care.
So how does it work? Is it a software hooked up to a computer and a microphone that we've got an interviewer listening to the patient? Maybe you can walk us through a little bit more of the mechanics of how it works.
Yeah, so what we need is any audio file. It could be this conversation here, Tom. And it's completely independent of what you say. As I mentioned before, it is just an assessment of how you create sound. So all we need to do is have a audio file. And right now, they're estimating between 30 and 40% of all primary care visits will be virtual or going to become virtual. But that doesn't mean only 30 to 40% of the population have a virtual visit. It means 100% of people have at least some of their care virtually, not all of it. But what that means is as long as we have some audio file, we can now do an assessment, a screening on anyone, and it's completely non-invasive. And so it works completely behind the scenes. We could have it running right now in the background, and the clinician could simply assess this conversation or actually get the result of this conversation to determine if, as a screening tool, if we needed further evaluation for depression or anxiety disorder.
That's interesting. So, like, for example, this week I'm going in for my annual wellness visit with my primary physician. So they could just have that going in the background and do that as part of the whole mental status exam.
Yeah, you can do any call center calls, any virtual call, really any type of, as long as we can get an audio file of about 20 to 30 seconds.
Wow, that's incredible. So I have to ask, based on your background, for healthcare leaders and entrepreneurs, listening in today, what advice would you offer them if they're looking to integrate artificial intelligence and machine learning into their own healthcare solutions? Can you provide us some guidance there?
I think we need to look towards tools that don't disrupt our clinical workflows. So that's one of the advantages of Kintsugi, is it can sit completely in the background. When we look at these artificial intelligence tools and other types of tools, when they need us to change our workflow significantly, that ends up being a significant detriment to the use of the tool. Our healthcare system, everyone is working at their limits already. So we don't have a lot of bandwidth to start to experiment and try new things. And so when we're looking at these tools, both the people that are creating them as well as the healthcare system that's trying to adopt them, we need to look at how are we going to take that technology and embed it into current workflows. In healthcare, disruption occurs through evolution. It's not a quick change. And so I think that's probably the most important thing for successful adoption.
Yeah, that's really helpful. So, Prentice, first of all, I'd like to thank you for the time and preparation to be our guru today. If our listeners want to learn more about Kintsugi or yourself, how do they learn more? Is there a website? Are you on LinkedIn? How do we learn more about what you and your team are up to?
Yeah, there's a website, Kintsugi Health, KINTSUGIHELTH.com. You can go there. You can feel free to email me. I'm at Prentice, PRENTICE @KintsugiHealth.com. You can certainly DM me on LinkedIn. I'm the only Prentice Tom. It's a pretty unusual name. So you can find me on LinkedIn, and I'd be happy to respond through that way also. But certainly visit our website.
Yes, for sure. Yeah, I'm going to do it and then I did some research for this, but I'm going to go back because your insights have been terrific. So, Prentice, I'd like to thank you for being our guru today. It was fascinating, and I appreciated all the insights you brought for us.
Thank you, Tom. It's a pleasure to meet with you.
Thank you. Thank you for listening to MedTech Gurus. I am Sylvester Harris, your MC. If you want to learn more about Tom and his consulting services, you can go to www.pctmedical.com or email Tom at tom@pctmedical.com. Now, I can be reached at Sylvester Harris, that's SylvesterHarris 5048@gmail.com, and I'd be pleased to discuss any voiceover work that you may want for your company or broadcast. Hey, thanks so much for listening, and catch us on the next episode of MedTech Gurus.